to talk to you about pterygiums. Now, pterygium is when you look into the mirror and you see on the white part of your eye, there's almost like a red and inflamed growth heading towards the colored part of your eye. Now, a pterygium is what we call in medical terms a fibro-vascular growth on the white part of the eye. Why do you get a pterygium? It's usually sun-induced. It's an irritation of your tissue on that part of your eye that gets irritated by a high amount of exposure to sunlight. Most of us will have it. It is especially in a country like South Africa where we have a lot of sunlight. When you notice it and it's quite obvious to you in a mirror and it actually bothers you, that is when the pterygium is inflamed. Now the pterygium can be inflamed due to maybe a lack of sleep, but maybe you've been in a lot of wind, when you have a glass of wine too many, when you are on heavy medication like painkillers and you kind of sleep with your eye open a little bit. That's all reasons for the pterygium to be inflamed. Now the inflammation can be calmed by using anti-inflammatory drops. What are the indications that we need to remove the pterygium? If the pterygium can be calmed down just by using anti-inflammatory drops and by avoiding conditions that's actually causing the inflammation, or reduce your exposure to sunlight by wearing sunglasses when you're outside. When we want to remove it, first of all, when it bothers you. When you look in the mirror, it's constantly red, people are constantly asking you, why is your eye so red and inflamed? It's almost a little bit scratchy as well if it stands up a little bit. That would be an indication for us to remove it if it really bothers you. If it really bothers Dr. Aleksic, it's also a reason for us to remove it. Why will it bother Dr. Aleksic? It will bother him when he looks through the slit lamp, which is like a microscope, and the tissue around that area looks suspicious. And by suspicious, I mean we want to make sure that it's not a tumor-like or a cancerous-like or something like that we want to get rid of and send off to a laboratory to check that the tissue is actually normal, and then we got rid of it. So when it gets to the point that we want to actually go ahead and do surgery, how will we do it? So it takes place in a normal theatre. You're not going to be under general anesthetic. So the morning of the surgery you can have a small meal. We're going to ask you to dress comfortably in your own clothes. You're not going to change over into the hospital clothes. Dress may be slightly warmer than usual because we don't want you to feel cold in the theatre. Your name will be on Dr. Aleksic's theatre list. You'll get pre-authorization from your medical aid so that they can cover for it. If we need to motivate why you need to remove it, we can provide you with a motivational letter. Your name will be on Dr. Aleksic's list together with your authorization number. So they will admit you through to the ward where you will meet the anaesthetist. He will ask you a few questions, take your blood pressure, and they will put local anesthetic drops in your eyes. And when it's your turn to go through to the theatre, you'll lie on a flat bed with your head in a little ring-like cushion like this. And say for example it's only on the one eye, doctor will cover the eye that's not being operated on. He will use a small speculum or a little clamp to keep the eye open, so you don't have to worry to keep it open yourself. And how is he actually going to remove it? Now, during the surgery you feel no pain. Doctor uses a local anesthetic spray around the eye area that will numb the area completely. Now what he then actually does, he needs to remove the growth. So he'll do that by using a diamond blade to cut the growth off your eye. But he can't just cut it off, he needs to put something back. So how they do it, and I'm going to explain on my own eye. Now, if you look down, some of the tissue that is underneath your lid, you'll take some of that tissue and use it because that tissue has not been exposed to sunlight. So it's a good healthy tissue to use. Underneath your lid, he'll take a piece of those, he'll cut that off and he'll put it onto the place where he removed the pterygium, and he will stick it onto that place with a tissue glue. He'll put an antibiotic drop in, anti-inflammatory drop in, close the eye, put a shield over, and then you'll go back to the ward where they'll offer you a cup of coffee or tea and a sandwich, and half an hour later when they see that you're fine, someone can drive you home.